start. Okay, so we will start. Welcome back, everyone. We will start this afternoon with our student lightning talks. So in this block, we will give students and research associates actually a chance to present their work through lightning presentations. They will have 5 minutes to present their research project. For this session, we don't have planned a Q&A, but maybe we'll have time by the end because one of our students canceled at the last minute. So today we have only 2 students presentation. And we will start with Valentin Olivier, who is a research associate working with Dr. Alexandre Lehmann at McGill University.
Thank you. Okay, so it's working. So hi, everybody. I'm very happy to be here for the first time. So today I will speak about Alzheimer and machine learning. So Alzheimer is one of the most prevalent disease neurodegenerative disease in North America. It is associated with faster rates of brain atrophy, and it suggests that the brain is aging in a more fast rhythm. And it is something very prevalent because up to 7.5 million of people in North America might have Alzheimer. And the current treatment, unfortunately, only manages the symptoms and not the root cause. So it is really, really important for people to have access to an early diagnostic tool, because first it will help the family to prepare to live with the disease and to manage the life of the loved ones. And also for the patients, it is key because it will help them to take the medication at the early stage, and it will be more efficient. So that's why there is a need, because unfortunately right now there is no such tool that can detect early manifestation of Alzheimer, and everything relies on significant cognitive decline. And when you have documentation of significant cognitive decline, unfortunately, it is already too late because you are not in an early stage. So then it is more difficult. So the objective of this project is ultimately to develop an AI tool that would be used to predict the brain health using neuroimaging data. And as a first step, we investigate to predict age of the brain using EEG and machine learning algorithm. So to do that, in fact, we have access to a biobank that is based in US, that is called the Child Mind Institute, which will consist of approximately 10,000 children aged between 5 and 21 years old. And there is a lot of data available. So there is a psychiatric data, behavioral data, cognitive data, and also phenotypical data. And the most important part is the fact that we have also access to multimodal brain imaging, several protocols in EEG, and also MRI. And what we did in the case of this project, that we extract some pre-processed EEG data from a resting state protocol. So that's a very basic EEG protocol where people are sitting, opening the eyes and closing the eyes. And when they have the eyes open, they are fixing across. So there is not much they are doing during the experiment. And we compute the EEG power band for each brain rhythm, so alpha, beta, gamma, delta, etc. And since the children had so many electrodes on the scalp, because it was high density EEG, so you have 128 electrodes on the scalp, we did a dimensional reduction using PCA to reduce the complexity of the data in input. And we train many algorithms. In fact, we train 5 classifiers using 114 children. They were divided in 2 categories. The first category, they were aged between 6 and 9 years old. And the second category, they were aged between 10 and 13 years old. And the best accuracy we obtained was with the gradient boosting, which is kind of an advanced random forest algorithm. And it was achieved with a learning rate of 0.5. The thing that is very interesting is the fact that to ensure that the accuracy is significant, we compute also the chance of our model using random permutation, 100 permutation to be precise, so that if we beat the chance of the model, that means that our accuracy is significant with an alpha of 1%. So although what I would mean by that is the p-value is inferior to 0.01, which is very good. Obviously, it's not perfect because it's only 76.6%, and this is just a very preliminary step. Why am I saying that? Because, well, I use children to train my models, and the context is Alzheimer. Of course, children are not concerned by Alzheimer, but this very first step was to see if we are able to predict age using EEG, I mean brain age, age, yeah, using EEG, and also using machine learning. And these first results confirm that yes, it is possible to predict the age of someone using EEG and machine learning. And the next step will be to, instead of using children, to use adults, healthy adults as a first step, and then also adults struggling with Alzheimer to ensure that the prediction will be more robust. Of course, we won't stay on machine learning algorithm. We would like to move to deep learning and, for example, to try with convolutional, that's a hard one to say, neural networks, so CNN, as Van Putten did in 2008 when he was trying to predict the sex of individual, and he used CNN and EEG time series, and he was able to predict the sex of people with an accuracy superior to 80%. So that would be a nice next step to try. And also, obviously, since we have access to many data beyond EEG, well, one of the other next steps will be to include MRI data, so that we will benefit from the good temporal resolution from EEG, but also the nice spatial resolution from MRI. And if we also enhance the matrix of features by, for example, including psychiatric data or other cognitive assessment, we might be able to go further the 80%. And that's it. I think I presented everything about this research project, and probably I did less than 5 minutes. Oh, and also, so this project has, just something I remember, has a nice potential for the future, because it doesn't aim to cure Alzheimer, but it aims to provide a tool that will help patients to be detected earlier. So that will make their life, their future life, more, how to say that, less morbid, right? Because they will be able to take the medication at a very early stage of the disease, so they will be able to have a better quality of life. And that's a key message. So such projects have the aim to improve the quality of life of patients.
Thank you for your presentation. Thank you for this great presentation. Our second speaker today is Jason da Silva Castanheira, a PhD student under the supervision of Dr. Sylvain Baillet at McGill University.
Hello. So I'm here to talk about individual differences. So what makes you unique? For me, I absolutely adore Mariah Carey. But how is this reflected in my brain activity? That's a very good question I ask myself. So I'm looking at brain fingerprints. And the idea of brain fingerprints is we're trying to understand how individuals are set apart from their brain activity and how this might be related to individual differences in behavior. And so I couldn't fit everything on a slide. So I'll talk a little bit about the background first. We validated this in healthy young adults firstly with MEG, where we looked at brain activity of individuals. And this brain fingerprint process is very simple. It's kind of like how you unlock your phone with your fingerprint or Face ID or whatever that is. The idea is your brain activity should be most similar to yourself, and your brain activity should not be related to other people in the room, for example. And so if this is true, if your brain activity is most related to yourself and not to other people in the room, we can say we unlock your phone or we correctly differentiate you from the cohort. And so we did this in a cohort of 158 people. And we find that we can differentiate people with very high accuracy, above 90%. But this cohort was healthy young adults. The concern here is that we know with aging, the neurophysiology changes of the brain. So we see shifts in alpha power, we see changes in the aperiodic or the shape of the spectra. And so the question is, well, does this brain fingerprint remain stable across the lifespan? So this is what I did in this current project. We had a cohort of many people that I did not collect, thank God. And we looked at how the brain fingerprint accuracy might change with age, and also the contents might change with age. So on the figure on the left, you see the accuracy we achieve. So we achieve very high accuracy regardless of what age group the participants are in. So to put it simply, we can unlock your phone, whether you're young or old, based off your brain activity, using this analogy. So the fingerprint itself is accurate no matter what age we look at, but that doesn't mean the contents are the same. And so here in the figure in the middle, we looked at contrasting the features that are most important for differentiating old adults and the features that are most important for differentiating young adults. And in pink are features that are more important for differentiating older adults. And in green are regions that are more important for differentiating young adults. And we see there's some sort of gradient going from superior to inferior. And so it kind of answers my hypothesis or my intuition that the features we're using for fingerprinting or differentiating people are not the same across young and old adults. But I have a background in neuroscience, and I'm very interested in biology. So I asked myself, well, are these features related to anything else? And so I looked at how this might relate to different features of our brain activity and our brain function. And so here I looked at structure. So I looked at how the cortex thins with age. And I find that the regions that show the most cortical thinning with older adults, because as we age, our cortex tends to thin, are also the regions where we can differentiate the older adults better. We also see regions that tend to be considered sensory modal or unimodal regions, or regions where we can differentiate older adults better than the transmodal or default mode network regions that are more typical, let's say, of the young adult brain. And I also looked at neuromaps, which is a cohort of normal maps of different neurotransmitter systems. And I see that specific neurotransmitter systems co-localize with these features for differentiating old adults versus young adults. So what does this all mean? Why am I here? This is a conference about AI. Long story short, what I'm trying to argue, and what other people have also argued in the past, I think, is that the features we use to differentiate people might not be the same across populations. The features that are most important for differentiating young adults are not necessarily the same for old adults. And so when we're training, models to predict behavior from brain activity, whether that be at rest or at task, or if I don't know what you're trying to predict, but it doesn't really matter. The point is that the models might not generalize across populations, specifically because the most differentiating features might not be consistent across the populations. And you can think of this to generalize across all sorts of people, where you're looking at high SES versus low SES, high education, low education. It doesn't really matter the differences, but the point I'm trying to drive here is that population neuroscience cannot, or I doubt, will generalize across all populations unless we take into consideration the actual people we're sampling from. And this is not to mention psychology, sampling bias, etc. But this is not the time and place for this. So on that, I will like to conclude and thank you for all your attention.
Thank you for this presentation. So maybe we can take one or two questions if you have about one of these lightning talks in the audience or online, as we finished earlier. can. Yes, you can both come back here. It would be easier to answer the question.
So my question was for Olivier. So it seems that your models manage to predict quite well the age of the kids, based on the EEG, if I understood correctly. Do you know what features?
Yeah, exactly. So what we did is to compute the power band for each brain rhythm, and the one that was the best, the one which gave the best accuracy was a delta rhythm.
Delta.
Yeah,
Okay.
the delta.
Okay.
And since you mentioned it might change with older population, so with young adult or with even adults or elderly. So basically, that's something that would need to be adjusted. So I tried every brain rhythm at once, and I tried to also use them all. I didn't try to do a combination of brain rhythm because then it would have been very time consuming. And this is the very first step, again, as I said. But yeah, it was the delta rhythms that bring the best accuracy.
Okay, thank you.
So we have a question online for Jason. What was the setup for collecting the data? I imagine that your brain activity would change or even entrain with others in the room. At the same time, I'm not sure that putting a brain into complete isolation and in a lab setting would generate a good fingerprint. So what is the setting for the most isolated brain state specific only to you?
So to preface this, I did not collect this data. It was an open data set. It was a typical resting state protocol where individuals were seated in the MEG in a closed room by themselves. And they did the exciting task of looking at a fixation cross. So it is not the most ecologically vast per se, but there's quite a bit of research showing that the fingerprints during rest or during different tasks tend to generalize. So there is some shared relationship between task and rest fingerprints.
Do we have more questions or?
So I was wondering which database, open database you use, because maybe I missed that, but can you tell us more about it?
So this is the CAMCAN dataset. So the Cambridge Center for Aging Neuroscience. It's 600 and something people. And it's all MEG with MRIs. I think there's also some fMRI in the data. And no EEG, unfortunately.
So thank you, both of you, for coming back here on stage and for your presentations. I guess we can. So this concludes our lightning talk session. Thank you everyone for coming here and watching this.